Welcome to this edition of FM On Demand. I'm your host, Mike Pizalka. Today I'm speaking with Chris O'Brien, Associate Executive Director of Financial Operations at Northwell Health's Long Island Jewish Valley Stream Hospital, about its small business rescue initiative to buy food for special events and the doctor's lounge from nearby restaurants. Chris, thank you for joining us today. I understand this was your idea, so let me start by asking you to describe what the program entails. For example, is the plan that the restaurants will provide all the food for the doctor's lounge or only some of it? How's it going to work?
Yeah, absolutely. First off, thanks for having me, Mike. I really appreciate it and you shining a light on this initiative. So how it's going to work, and ironically, this started in a budget meeting, right? And generally in a budget meeting, you're looking to save expense. But one of the things that stood out to us is that we were spending about $400,000 a year annually on catering, internal catering that was being done by our own local kitchen staff. And at that time, specifically, because it was a few months back, there was a lot of, I mean, it still is, but there was a lot of disruption in the restaurant industry with all the different restrictions that were around COVID. And just felt like, why are we taxing our own internal staff and we're spending such a great deal of money, yet when I drive in, to the hospital, and I grew up in the area, so I know a lot of the businesses pretty well.
Mhm.
When I go past, I see a lot of these businesses have either shuttered, reduced their hours, and that's a pretty sizable amount of money without us spending any more money that we could just reinvest back into our community. So, our executive director here was completely open and willing to doing something like this. So we decided that we were going to reinvest all that money in the community.
Mhm.
What took so long from the budget to then getting us to where we are from an implementation phase was we didn't just want to allocate it out to any business, annual business. We wanted to go out there. We wanted to meet with all of the individual business owners that were local in our area. We wanted to talk to the owners. We wanted to hear their stories. We wanted to see what their backgrounds were like, if they've been going through any hardship during COVID, what their plan was for the future. And we met with about 40 different businesses, all restaurants, and we narrowed it down, at least for now, to having 9 restaurants participate in that, and that we made a commitment that we would give a minimum of $30,000 a year to each one of those 9 restaurants.
And so this is going to be the doctor's lounge food, all of it, or just some of it?
All of it. Yeah. So, one of the things that used to, really restrain the director of food and nutrition locally here was we want to do a lot of different initiatives here to enhance our patient experience, right?
Mhm.
The days of hospital food being hospital food, we want to be over. And we believe that food enhances the patient experience. But in order to enhance the patient experience, you need to have resources to do that, at a time when we're also not doing that great financially either, considering some of the circumstances with COVID. So how do you find resources when you don't necessarily have the money to reinvest those? Well, now you find ways to utilize your resources better. And we were utilizing a number of resources in order to do all of this internal catering. So by us outsourcing that, we were actually able to repurpose those resources. And now we're doing a lot more stuff around enhancing patient experience, doing in-room dining, all things that we really should have been doing all along with those types of resources. And to your point, it's all doctor's lounge. It's every other event that we do in the hospital that we traditionally would have went through there. I mean, with some exceptions, the only exceptions being if we were bringing somebody into the hospital to show, hey, the hospital's different. The hospital doesn't have hospital food anymore. We may want to show off our own internal staff at that point to show how tasty our hospital food is. But besides that, everything is being outsourced. And the other thing, and I know this is food, but what that really, once that started to take off, what that did is it sparked an interest in us to say, well, what else do we spend money on that's not food?
Mhm.
So what phase 2 of this will be, and what my commitment has been to the community here is that I'm going to look at every single dollar that's within our supply chain, and where applicable, we're going to repurpose all of that money, or as much of that money as we possibly can, back into our community, right? So promotional items, apparel, anything that we can do, we're going to now put money in back into our economy locally here. And one of the reasons why we're doing that is, one, we're a community hospital, but we were in the epicenter of this virus. I mean, especially when it hit with the first wave.
Mhm.
And that was a tough time. Uncertainty, despair, a lot of days where you felt like things were hopeless. But the only thing that was really a positive and a constant during that time was you'd walk outside and you'd see that unwavering support of the community through parades, through donations to the hospital, whether it be food or, apparel, all different types of things. To walk down a hallway and see, uh, instead of having artwork, we basically had all handmade posters from children saying, you're our hero, you're this and that. Those are the things that really got us through those tough times. So I'm big into gratitude and generosity reciprocating, right? So hopefully, as we're coming out of this, and hopefully,
Yeah.
uh, you know, uh, it's our time now to get them back here, and it just breaks our heart to see a lot of people within our community struggling, specifically in restaurants. I've always been such an admirer, and the restaurant industry is being impacted, not because necessarily the places, their food isn't great, or they picked a bad location, or their product isn't up to what the rest of the competition is. Their lives and their businesses are being impacted by something that is completely outside their control.
Mhm.
So where possible, we're going to try to help in any way that we can, with the hope that, maybe we aren't alone going to be able to make that difference, but that other businesses look and say, they basically invested $400,000 into their community without adding one incremental dollar, to their expense line. They just got better. They got smarter at spending their money better.
Mhm.
Uh, why can't we do the same thing? And then who knows what that can turn into for all the different communities around us.
Can you mention some of the restaurants that will be participating, what their menus are like?
Yeah, so it's diverse, right? So,
Mhm.
and one of the things outside of finding the stories was also, we wanted to make sure that the food choices matched the diversity of our employee base, right? We're on the border of Southeast Queens, which is one of the most diverse places in the country,
Mhm.
right? So you can imagine we have a very diverse employee base, right? So the food is from uh, Haitian to Jamaican, Asian fusion, down to barbecue, to Italian, to Thai food. We pretty much have tried to hit as kosher. Obviously, we have a high number of Orthodox Jewish employees as well.
Mhm.
So we've really tried to get as much diversity around the cuisines as possible. That was one of the things that we've really focused in on, outside of obviously the taste of the food and the story behind the business.
You said you kind of got the idea of the budget meeting. What was it that kind of prompted it? What gave you the idea that, hey, this would be an interesting idea to pursue?
Yeah, I mean, again, I think a lot of it had to do with just seeing how everything was
Mm.
unfolding, in the country, and seeing, a lot of people that I know, are involved with small businesses as well. I saw that, and it was something that I think for the longest time, I think journalists, media, I think they've done a great job over the last 18 to 24 months, really putting a spotlight on the people within these hospitals, right? People that I get to share a platform with each and every day, making them healthcare heroes. Each one of them deserves that honor.
Mhm.
But there's so many other heroes in this country and in this community that need to be focused in on. And I think that there's no greater one to focus in on than the entrepreneur. I
Mm.
think that entrepreneurs risk everything. They put their life savings into their business. And again, like I said, for that to be, to take that kind of a risk and to have their business detrimentally impacted by something that was completely outside their control
Mhm.
was something that just didn't sit right. So when we saw that pop up, and obviously there was a mutual benefit too, in that it could create some operational capacity for us to alleviate some of this. It just seemed like a win-win here, you know. And I think again, what COVID really did for us, not that we've ever lost that, and Northwell is very good about it, but it reinvigorated what it means to be a community hospital, right?
Mhm.
And being a community hospital is not about generating the most amount of margin, you know, and trying to find the most amount of surgical elective cases to find, you know, in the hospital. When you boil down, you're a community hospital to take care of your community, and traditionally, the way that you treated your community in healthcare was people presented through the four walls of your hospital. They presented with some kind of illness or disease, and you treated it. What this organization at Northwell has really put an emphasis on over the last few years is there's a lot of things that are ailing our community that you won't ever see them come through those walls. And it's still upon us to go find those things and help them and treat what's ailing them outside of those walls.
Mhm.
Uh, so, in a lot of ways, this is no different than any other population health initiative that we're trying to get off the ground here, because certainly small businesses are the lifeblood of our economy and so many people's lives.
So are those basically the big advantages for the hospital, the closer ties to the community and also taking some of the pressure off of the in-house food service staff? Are there any other advantages that you see for the hospital from this?
No, I mean those are big, right? I mean, you know, being able to create a cult, it also helps in our culture, right? To show that, um, you know, it's you need to give back to your community. When, you know, I think outside of being a dad, and being a husband, I don't think there's a greater title to have than to be a leader. And when you're a leader, you're awarded a privilege of having a platform. And what I want every one of the leaders that work for us to know is that when you get that kind of a platform, you need to utilize that platform each and every day for good, right? And
Mhm.
an initiative like this, I hope, you know, even though I think it has a lot of different benefits, I hope the greatest benefit is that it shows that each one of our leaders needs to think like that. And if we think like that, we could really make this community a much better place.
It sounds like something that other hospitals might want to take a look at. What advice would you offer to them if they're thinking of doing something similar? Anything they should watch out for or pay extra attention to?
Yeah, no, I think you know, I think other hospitals should look at this. I also think that other larger organizations should look at this as well. And even you could be a smaller organization and look at this. I think the message to take out of it was that we did not, this is not a donation, right? This is not a, you know what, we're going to then take another $400,000 of expense out here, and we're going to reinvest it. You know, I always say lazy organizations cut expense, smart organizations find ways to spend money better. So my advice to that, you know, to other Northwell hospitals, other competitive hospitals, other industries out there is just you don't need to have that money necessarily to make a difference. Just relook at everything that you're doing. And I can guarantee you in your business, there's always dollars and cents that could be spent in a better place. You just have to look for it, right? So don't just sit there and wait. And luckily, if this opportunity fell in our lap during a budget process, but 12 months a year, you should be looking at your financials and consistently questioning the status quo and saying, you know, I think so often in businesses, I think we just, well, this is the way that we've always spent our money, so we're going to do that. Um, I think in order for us to really get ourselves out of this, get our community out of you know, the mess that has been created as a result of this virus here, I
Mhm.
think we need to start looking at things differently here. And that's why even earlier today, we had a meeting about all the other things that we could potentially, you know, move, you know, out of, you know, traditional large corporations here and take that money and put it into businesses that so desperately need it.
Interesting idea. Chris, thank you so much for giving us a little time today.
Thank you so much, Mike. I really appreciate it.